Visit them on the floor. We're so glad to have everyone here, and let's get started. Our first exhibitor is going to be Vince Raceno with Carestream Dental.
Good morning, everyone. How are you? This is not what I expected, so I apologize in advance. I'm going to do the best I can. I do want to thank you for the many, many different styles and colors of underwear that you guys are wearing this morning, so thank you. If you notice when Seji came up, the scanner is really that easy to use that even he could use it. It just started doing it on its own. I wanted to start with the video to really just give you an idea, seriously, about a live scan. You can see in the upper right how the scanner is being moved in the mouth. And just a real scan that you'll see, there's occasionally a little bit of lip or a cheek or tongue that gets caught in the scan. The software takes care of that on its own at the very end. But if you don't know what we're talking about, this is a intraoral scanner in lieu of a traditional impression, that is, to be able to transition to that. So as this plays out, we'll in another minute or so, we'll go through some highlight overviews of the scanner, maybe the things that you might deem important, and how it could actually work in your practice. This is nerve-wracking. So you capture lower, upper, and bite. There are many different ways to scan. You don't always have to do a full arch scan unless it's for an orthodontic type appliance or other multiple units that you're prepping and so on. Palate, of course, if you need ortho. But you can scan for implants, for restorative. We'll talk about all that. There's no limitation as to what it can be used for. By the way, before I forget, Carestream Dental is 1525 is our booth number. I have a presentation that's designed to occupy 4 hours of your time. So I apologize for the skipping that's going to go on through this many, many slides. But if you get a chance and you have some interest, definitely visit us, and we'll be happy to spend the time and have you scan with it and kind of go over all the questions you might have. So let's get started. This pretty much sums it all up, the way it arrives, what it takes to install it, and what it takes to get going with it. Again, the different workflows, ortho, restorative, implantology, it's all included. So what they're doing here, one of the preferred workflows is to be able to scan the quadrant or the arch prior to the tooth being prepped or teeth being prepped, and then having basically the entire impression be done while the patient is numbing, so that when you come back in the room and actually prep the teeth, you're able to only scan the prepped teeth, and they're being dropped into that same arch that was previously scanned. So that's what this is demonstrating. Transmission to the lab is instant via a online portal that we provide free of charge that connects you and your lab, or labs, as many as you work with. And the turnaround is considerably faster. Anybody using a scanner currently or has any experience? Some hands. So you guys may have seen some of these benefits already. There is a learning curve. If no one's told you that, there is a learning curve. You're going to have to learn to scan with it, but it's well worth it. In my opinion, it's a lot like transitioning from digital radiography. Those of you that have been through eliminating your film in your back room with the development and so forth, and staring at little squares on a light box, versus having instant digital feedback, that's the same kind of thing, transitioning from a traditional impression to a scanner. So let's go through a few slides. It says here I got 5 minutes and 15 seconds. So I just mentioned this. Higher accuracy has really been something that's been well documented. You can easily just Google that yourself and do a bunch of reading on why it works and why the 16 or so human steps that we're eliminating when we're taking a traditional impression. And, you know, with digital, you don't find out after the fact that there is a problem with the impression. So if you pull it out of the mouth and there's a void, there's a bubble, there's something where what do I do now? Do I take another one? You know, end up with 3 sometimes in a baggie, right? Send that to the lab. We've all been there. This doesn't happen. This is a video game. It's digital. It's happening in front of your eyes. It's either good or it's not, and you can see and make the necessary changes right immediately as you're scanning. So going through conventional workflow, we're not going to spend too much time on this. You guys all know what it is. How long do impressions take? In most of my presentations, wherever I travel, it seems I never get the same answer. So I don't know. That's something for you to think about if you take all of these things into account, what the workflow in your office is. It'll be a simple ROI. We mentioned implants. Again, there's going to be a lot of skipping. Open tray or closed tray procedure where you're dealing with transfer copings and things of that nature is a thing of the past. You're able to scan something called a scan body, which represents the implant or the lab that it comes from, and it could. That's what you basically end up scanning to get a custom abutment made and a crown for the final restoration. Competitive analysis, we're not going to spend much time on either because we don't have it. But market overview, some of the scanners are still on a trolley base. If you remember nothing else, Carestream Dental is a software equipment company. When we sell you a piece of equipment, it's yours, you own it. The data that it produces, you own, which is very different than many of the scanners here on this floor, right? There is no upload to a cloud where the image isn't any longer yours. It is strictly yours, just like every other imaging modality that you have. So what is it used for? What can you use it for? Traditional crown and bridge, restoration, bridges, partial dentures, surgical guides, all types, aligners, night guards, custom tissue colors, 3D models. Sleep apnea is a huge area that is growing considerably digitally, that is. And again, we're happy to share all this information if you're able to swing by the booth and ask me, and we'll show you. Selecting the right scanner, I think we need to definitely focus on this. Another huge benefit of Carestream Dental is being able to integrate your scanners. You saw some of the other units. They're a cabinet. For all intents and purposes, it's this podium. This podium arrives to your office. This is not tied to your database that you currently have, whether it's EagleSoft, whether it's Dentrix, whether it's one of ours, it doesn't matter. Having the ability to integrate your scanner into your practice management software is proving to be priceless, and it is unique to Carestream CS3600. In other words, you're able to go in Dentrix. I am already a patient of record. Look me up, go into my chart like you typically do, and then launch the scanner acquisition from that, as opposed to constantly re-entering every single person that comes to your door. So I hope I beat that horse to death pretty well, because that's important. And it needs to be simple and easy. It really does. Dr. Christensen, if you still follow what he says, I was fortunate to spend some time with him and Rella last year in Utah when they did the evaluation for the scanners, the top 4 scanners on the market. He loves us above all else for what he called, quote unquote, no nickel and diming, meaning you buy the equipment and that's the end of that. And secondarily, that it truly is that easy to use that you can hand it to someone and in 10 minutes they're scanning. You'll be fumbling around or whatnot, but you don't have a limitation on angulation, on depth, whether you're touching the tooth, whether not. There isn't any powder or opaque liquids or anything that has to be sprayed on the teeth. It is just really a simple unit to pick up and go and learn so that you can experience a 2-minute impression. That's the goal, to be able to do it all in 2 minutes, upper, lower, bite, the whole thing, right? Full mouth I'm talking about. If you're doing a single posterior zirconia crown on number 30, all you need is the quadrant, the antagonist, and the bite, and you can move on, and that's much faster. So with 20 seconds left to go, I thank you very much for your time. My name is Vince. I hope that satisfied some of your curiosity, but if not, 1525 is Carestream Dental. Thank you.